Hello everyone, welcome to my channel. My name is Alona Forche. I am a retired public health nurse, a lactation consultant and an educator, and as well as I'm an author of many education and nursing books. Today, as I promised in my previous video, I want to talk about one of the most number one important problems that women complains is breast engorgement. Now, in my previous experience as a public health nurse and a lactation consultant, in our breastfeeding clinic, I see women before they even sit in my chair, they start crying. You know why they start crying? Because they start crying because of so much pain in their breast, because of severe engorgement. Now, what is engorgement? Engorgement is when your breast totally double its size, maybe it triples its size, and it's filled with milk, it's inflamed, it's red, and it's even painful to touch. That's engorgement. And why women get engorgement? Why do you think women get engorgement? Well, number one, they may not be breastfeeding frequently. Let's say not breastfeeding every 2 hours, every 3 hours, or mommy just get tired, or the baby just sleepy and not willing to breastfeed, or the mom has tons and tons of milk and unable to empty the breast fully. Or one of the most important factor that cause it is when the baby's latch is ineffective, meaning the latch was off, the latch wasn't good. So that's why the baby was not fully suctioning or emptying the breast. Now, when this engorgement happens, engorgement varies in every woman. Some women will have engorgement after 3 days, some women will have it after 5 or 6 days, others don't even experience it. So, with that, women, we have tons and tons of milk, is really high risk for getting engorgement. Okay, so what you can do to prevent engorgement, breast engorgement? Now, you can massage it by hand if you can touch it, because I've seen women, even when I put my hand on their breast, they scream because they're just so much inflamed. So you can massage it manually. The worst thing you can do with severely engorged breast is when you pump it. Why? Never pump a breast when it's severely engorged. Why? Because could you imagine, just imagine your ducts are inflamed and you pump that machine. You force that milk to come out from that inflamed ducts. Could you imagine the pain? It's gonna swell more. So what you can do, put a cold compress on it. Some people or some healthcare provider will say, put a warm compress. No, in my experience. Imagine a severely inflamed breast and you put a hot compress on it. What's that do? It will improve the flow, the blood in it, causing it more inflamed. While if you put a cold compress on it, it slows down the swelling. So it helps relieve the pain. So when the swelling goes away, the milk will freely flow. So put a cold compress, 10 to 15 minutes. If you can massage it gently, do it. If you cannot, you can just use a hand compress it, put the the cold compress, and just slowly press it, compressing with your hand. Now, there's one way how to relieve engorgement, and you need your husband to go with it as well. So, imagine this is your breast, severely engorged. And if husbands are watching right now, you need to learn this trick, okay? Breastfeeding is not just for baby, it's not just for mom, it's a teamwork, people. So husband has a job to do, okay? So I don't know if you're familiar with the so-called reverse pressure softening, or RPS. Reverse pressure softening helps to relieve engorgement. And how are you going to do it? So husband, pay attention. You have 4 fingers, okay? Lotion on, put lotion, oil, coconut oil, whatever you need, whatever you have. Mom is laying down flat, in the couch, in the bed, whatever, wherever. So use the 4 fingers. I tried to manage it, massage it, demo it closer to the machine so that you see it. Use your 4 finger to push that milk down, not going this. That's wrong. So you pressing that milk to return all the fluids to return back into your system. Now you may notice when you engorge, your armpit also engorges, as well as all this part engorges. Why? Because as women, our milk line starts here, going right into our groin. So you see women, I've seen 3 in my patients with abnormal or extra nipple in their abdomen, and when they get engorged, when they have milk, it also leaks. So it's a extra nipple, we call it. Okay, so you have to massage. If your armpit gets swollen, you need to massage it outward, going this way, outward, to return those fluid into the lymphatic system, outward. So for your breast, making sure you massage it going this way, okay, going this way. When the breast is not severely engorged, just mild, moderate, you can take a warm shower or you can use a warm compress. So that's the difference with a severely engorged and a mild engorged, okay? So never use a warm or hot compress into a severely engorged, but you can use it in a mild engorged. Why? Because the pain is not overly inflamed and it triggers the milk, the letdown of the milk, and the milk will come out and relieve that pressure. So that's it for the engorgement. Some people with engorgement will get fever. That's normal. Doctors would say you can take ibuprofen for inflammation. Make sure you ask your doctor if you're taking any medication, okay? Now take note, most of the medication that the mom takes in, either acetaminophen, ibuprofen, they are safe with breastfeeding. But make sure you consult your doctor before you take any medication, okay? So that's it for today. The next video, probably I'm going to talk about how to express your milk in pump or massaging it, so that you'll have some ideas on how to make use of your extra milk if you have tons of milk. And people who have insufficient milk supply or lack of milk supply, I will be also doing some videos on that. So for now, thank you for watching. Have a nice day.